Hi everyone. I know I am getting off to a late start, but it is my first time doing this and I'm very excited. So just bear with me. I'm sure as the weeks pass, this will get more structured and I can get your information out to you sooner. But someone wanted to know about C-section, so I just wanted to give like a little basic overview of C-section and the indications that can lead to a C-section versus a vaginal delivery. So most women don't go to labor and delivery with the thought that they'll have a C-section, but sometimes that is the most safest thing to do for mom and baby. And as women, we just roll with the punches and do what we have to do, especially in that moment and especially for our baby. So some of the indications for C-section are non-reassuring fetal heart status. So if your baby's heart rate is dropping below baseline of what it's been, and every baby can have a different baseline levels, the most important thing is it's between 110 and 160. So your baby's heart rate shouldn't be too far below 110 and it shouldn't be too high above 160. But if the status of the heart tones are not reassuring, if the interventions that we're implementing to bring that heart rate back up are not working, then you could end up having a C-section. Another reason for a C-section could be maternal distress or exhaustion. So if you get to complete, you're 10 centimeters dilated and you're pushing for hours, 4 at the most, and you haven't made much progress, then you can have a C-section for that reason as well. Breech presentation. This means that the baby's head is up instead of down, and baby would be essentially coming out butt first instead of head first. You can have a C-section for that reason as well. Arrest of dilation and arrest of descent. So arrest of dilation basically means you do not make it to 10 centimeters. We need your uterus to be fully dilated before we can even attempt to deliver a baby vaginally. The risk of trying to deliver vaginally and not being 10 centimeters dilated and fully open are very significant. You could rupture your uterus, and this means that your uterus could burst. And that's a very serious situation. And in that situation, we would have to act really fast to get the baby out. Arrest of descent. This means that your baby doesn't really come down into the birth canal further enough or doesn't descend low enough into your pelvis. And if baby is way high, you'll push and push and push for hours. And if baby never comes down, then you'll have to have a C-section because we have to get baby low enough to get out. And then I'm pretty sure it's a lot more, but another big one is an elective C-section. This is for moms who have already had a C-section before. Some women like to try a VBAC. This is a vaginal birth after C-section, but some women are just like, nope, not doing it. Had a C-section once, I'd rather just do it again. When you do it the elective way, it's easier. You schedule it, you come in, and we get it done really quickly. And then multiple gestation is another one. So if you're carrying more than one baby, you're always at risk for C-section. Everything is more complicated when it's more than one baby inside. So during a C-section, most people get a spinal anesthesia, and this means that you'll be awake, you'll be numb, but you'll be awake and you'll be present for the delivery. In circumstances where it's a stat or it's urgent or it's a really big rush, sometimes we have to put mom under general anesthesia, and this means that we put you to sleep totally. So you're not awake or present for the delivery of the baby, and you are most likely intubated to breathe, to help you breathe, and that's that. Sometimes that happens. So the incision is different types of incision. Most of the doctors that I work with do low transverse incision. So this means that they cut a horizontal line really low on the abdomen. Sometimes if it's really urgent, and if we're trying to get baby out as fast as we can, and if it's safer to do a classical C-section, which is a vertical incision, then vertical incision happens. But most times, try not to do that. That's just a little touch of the surface. It's a lot more, but I hope this helps someone, and I hope that you are not scared to get a C-section. It is a scary thing. It's not ideal. It's not what we normally want, but it is safe. It is major surgery, and it should be treated as such. The recovery time is a little different than someone who had a vaginal delivery. Instead of about 6 weeks, it's 8 weeks of recovery. You have to watch for infection of the incision. You have to watch what you're carrying and what you're holding and what you're picking up, because you don't want the incision to dehisce or reopen. And your doctor will give you a lot of information too about how to take care of yourself and your incision after C-section. So I hope this helps someone, and thank you.